All right. Well, now that it's recording, I am going to go ahead and get started. And as so many said before, thank you all for registering, for being here, for being willing to participate in Lansing Days. Especially, I know there's a lot of new folks who are going to be joining for the first time this year, and a lot of obviously returning folks. As Roy said, they caught the advocacy bug and were, able to come back for this year. So we're very excited about that. But I think one of the things that has been hammered home with me from Gwen, from Susan, from everyone else at HFM, and I've heard from so many community members is the long history of advocacy with, not only the broad, bleeding disorders community, but HFM specifically. And so know that it may be your first time going to Lansing and advocating, but there's a long history of people that have come before you that you can rely on. Each group that you will be in will have an experienced member. You're not going in these meetings alone, and you're not alone. Even if it may feel like it's kind of you just talking with a legislator, know that you can rely on your fellow group members, and know that there's a long history, as I said, within this community of advocating. So again, thank you all for being here and for registering. And we're very much looking forward to having you join us in Lansing to talk with legislators, with staffers, to get across the message that we have for everyone. So now I'm going to get into kind of what you can expect from Lansing Days. So on Tuesday, March 24th is when we'll have our training. So everyone will start at the Kellogg Hotel in East Lansing. So when you get in, we're hoping that everyone gets in around 5 o'clock. That's when registration will open. That's when you're able to obviously check into the hotel. And then from 5 to 6 is when we'll have registration open, so you can stop by, and pick up or check yourself in and start to mingle with everyone. We'll start with issues training, or we'll start first with dinner, make sure that everyone gets fed. Dinner will start around 6. We'll have Susan and Gwen kind of kick us off, get everyone ready for a fun night of legislative training. I'm going to try and make it as fun as it can be. Sometimes legislative training and dealing with legislative bills can be a little boring, but we're going to try and get through that and make sure that everyone feels comfortable with all of the issues that we're going to be going over. So from 6 to 7 is when we'll have dinner. And then starting at 7, we'll have a keynote speaker. I'm still waiting for that to be confirmed, but fingers crossed it's going to be one of the state senators from Lansing. But again, their schedules are pretty up in the air, but I'm waiting for that to be confirmed. We'll hear from them, and then right after they are finished, we'll then roll right into the actual legislative training. We'll hear from myself, Matt Delaney from NBDF, as well as some patient advocates that have come before and are very experienced in this work. So that's what to expect for the issues training. Of course, the stay at the Kellogg dinner, breakfast, and lunch while you're with us in Lansing will be free of cost. We will also be paying for parking at the hotel, as well as parking near the Capitol. I'll make sure to explain kind of where the best place to park is when we go to Lansing on Wednesday. But everyone will be receiving, or each group will be receiving $15 to cover the cost of parking in garages near the Capitol. And then in terms of meetings, the meetings will vary. So not everyone is going to have the same amount of meetings. So some of you may have just 3 meetings throughout the day. Some of you may have 5. I know I'm looking at Ken Martin last year. I think ended up with 6 or 7 meetings. Yep, he just said 7. And I know he was running around the Capitol, but we try to make sure that everyone is meeting with at least 2, but usually no more than 5. That was an outlier last year. But really the key thing is, we want to make sure that everyone is having a good time in these meetings. I know it can feel scary to be in these meetings and meet with legislators and meet with staffers, but the key thing, and I think Keith said this earlier, is you hold your story, which is the most important thing. You should feel confident going into these meetings, knowing that they are trying to learn from you, learn about the issues, learn about what it's like to live with a bleeding disorder or care for someone with a bleeding disorder. And as it says on this slide, know that you're not alone. You have your group to rely on. You can turn it over to someone else if you feel comfortable talking about a specific issue, but know that you have your story to fall back on, and really that's what they want to hear. I can throw facts and stats and numbers at them till the cows come home, but really what they're going to remember is who they met with, the story that you told them, and that's what they're going to take back to meetings, to meetings with their boss if you're meeting with a staffer, or to meetings with other legislators if you're meeting with your senator or representative. So that's what to expect. And I also should mention, feel free to interrupt, raise your hand, come off mute at any time if you have any questions. I don't want this to feel like you have to wait till the end and then you forget a question or anything like that. Feel free to interrupt me at any time if a question comes to mind. Let's see if it will. There we go. So as I said, this is the Capitol map, and I'll give you kind of a rundown of where the best place to park is. So of course, the Capitol, not all of the meetings will be in the Capitol. It's really predominantly only that's where the Senate chambers are, the House chambers, and then that's where House and Senate leadership have their offices. The other buildings where you will be having meetings will be this one, which says Capitol View. That is the Senate office building, also known as Binsfeld. And then the House office building is right here, and that's Anderson House office building. Anderson can be a little, I want to say, wonky. It's got two towers associated with the building. There are the North Tower, and then just kind of the general office structure. It will be listed whether or not you're meeting in the North Tower. It'll say N and then the room number. And so just know that you'll have to take, there's a specific elevator you'll have to take. What I always end up doing is asking one of the security guards that's in those office buildings, just because I always end up taking the wrong elevator. And they are the most knowledgeable people there. They're there every single day. And so it's always helpful to ask them, just say, hey, I've got a meeting in the North Tower. Is it the second or the first elevator that I should take? And they will always, be willing to help you. So that's where most meetings will be, either in Binsfeld or in Anderson. Our actual conference space, where you'll be able to, put your stuff down, where we'll have lunch, will be here in the Bogie Tower. So it's right across from the Capitol. It's super convenient to the Senate office building and the House office building. And then the best place to park would be this parking structure right here, which is the Townsend parking ramp. So that one is technically associated with the Senate office building. So you'll see that there are some spaces that are reserved, but there is plenty of parking in there for when you get to Lansing. And that is usually the most convenient place that I always end up parking when I go to meetings. And so that's where I would recommend everyone park. It is the Townsend parking ramp, which I'm originally from Massachusetts, and we don't call them parking ramps. So that was very interesting to learn when I first got here. All right, so now, how to prepare for meetings. I think the most important thing, and I know it's listed fourth on here, is comfortable shoes. I think that's one of the most important things. A lot of the floors, whether it's in the Senate building, the House building, or in the Capitol itself, they are marble floors or concrete floors, and it's not always the most comfortable to be walking around in. You are going to be walking in between meetings. And I tried to do my best to space them out, so you're not having to run, but you will be having to walk between meetings. So please wear comfortable shoes. Take the time in between meetings to rest. Obviously, eat once lunch is there. But other than that, the most important things to remember to pack are a photo ID. When you go into the House and Senate buildings, You will have to show ID. It's similar to going through TSA, and then they'll usually just ask, "Look, oh, do you have a meeting?" You just say, "Yep, we're meeting with Rep so and so or Senator so and so," and that's usually it's super quick. Shouldn't take more than 5 minutes to kind of get through security. But do remember to pack a photo ID. Also, if you don't have a red HFM advocate t-shirt, we will have them, but please don't forget to pack your red HFM advocate t-shirt. That way we can, when we take a photo in front of the Capitol, everyone can be wearing the red t-shirt, and we can make sure that all the legislators and staffers know that HFM is at the Capitol. For the Tuesday evening training, you don't need to be dressed business casual. Feel free to come in whatever is comfortable for you. But then Wednesday, we do ask that you show up in business casual, just because in these meetings, the legislators or the staffers will also be dressed as business casual. And so feel free to wear your red HFM advocate t-shirt over, a button down, or wear a blazer on top of the t-shirt. But make sure to wear business casual, so that way we're respecting the meetings and respecting the legislators and staffers that we're meeting with. And then finally, and maybe most importantly, is any storytelling items that you feel would be beneficial to you. You'll hear from some patient advocates on next Tuesday, some of the items that they've brought to help them tell their story. And it could be as simple as, the vial of factor that you last used, to kind of highlight, how small something so expensive can be. It could also be, I'm thinking of Becky Steele. Hopefully I'm not stealing her thunder, but I know that she has a really fantastic storytelling item, which is all the caps of the vials of factor that her son has taken. And it's a really, impactful visual for, I still remember it, and it's been over a year since I've seen it, but it's one of those things that people will take home and they'll think about even after the meeting, and they'll think about, weeks or months later. And so feel free to bring any storytelling items that you think would be most helpful. And trust me when I tell you that staffers, legislators will remember those items, and will remember your story when you have those items as well to kind of coincide with that. So in terms of your story, I think the most important thing that you can do is know that, as we've said before, feel confident in your story, and know that you know it better than anyone else. No one, is going to be able to tell you, "Oh, well, I don't know if that's quite true." This is your story, and you should stick to it, as they say. So when you go into meetings, make sure to let them know who you are. Feel free to let them know where in their district you live. It may be that they are also from, the same town, and you can kind of have a quick chat about that. Some of the staffers are going to be from kind of the district as well. So it's a great way to kind of connect with them. And then it also helps them know kind of who the constituent is. So you are going to be in meetings with people who aren't necessarily the constituent. Make sure to highlight and make sure to have whoever the constituent is lead the meeting. And then you can go right into kind of having a bleeding disorders 101 talk. We try our best to talk with staffers and to talk with legislators and help them understand what a bleeding disorder is. But there's only so many people. It's hard to kind of get to each office. Make sure to highlight and help them understand what a bleeding disorder is, how it impacts your life, how it impacts your loved ones. And that will help them kind of understand better and take it back to meetings. And as I said, help them understand what it's like to live with a bleeding disorder, take care of someone with a bleeding disorder, and then feel free to, if you are able, relate that into, the issues that we'll be talking about. I think one of the things that I maybe haven't in the past highlighted, but I want to highlight now is, we have a long list of issues that we're going to be asking people to talk with their legislators and staffers about. But don't feel like you have to hit every single issue in a meeting. So we have, I think it's 6 issues that we're going to be asking people to talk about. You only tend to have about 15 to 20 minutes 30 minutes if you're lucky when you're talking with legislators. It's going to be really hard to try and, talk about yourself, talk about your story, and then cover those 6 issues. That is okay if you don't. What I want everyone to focus on is focus on telling your story. And if your story relates back to one of the issues that we'll be talking about, that's great. Feel free to talk about that, but don't feel like you have to hit all 6. I'm more than happy, and it is my job to follow up after with all of these offices. And I'm more than happy to meet with them and do follow up work to then go into each of the other issues. So don't feel like you have to hit all of them. And now, the moment that everyone's been waiting for, we're just going to quickly cover the asks. Again, this is just a primer. Don't feel like you have to have all of these memorized. We're going to be going over all of them on Tuesday. We'll have plenty of people, not just myself, talking about these issues. So I want to make sure that this isn't, it's not going to be your first time hearing them next Tuesday. But even if it's your first time hearing them now, that is okay. You'll be getting a lot more information on Tuesday. But our first ask is one that we've been working on for quite a while. It is supporting legislation to ensure that all copays count. So for those that don't know, there are programs within insurers or that insurers have called copay accumulator adjuster programs or CAPS. And what this does is take copay assistance that a patient receives, but it does not count it towards a patient's deductible. So the analogy that I always tend to use is think about a college scholarship. You have, a $40,000 tuition, you get a $10,000 scholarship. The college takes that $10,000, says thank you very much, and then turns right around to you and says you still owe $40,000. And you're thinking, well, hold on, it should only be 30,000. I had that scholarship. And they say, no, you need to have skin in the game for your tuition. You owe the full amount, your full tuition. That is the same thing with copays. And so we're trying to make sure that patients are able to have their assistance count towards their deductible. We want to make sure that insurers aren't double dipping. And so that's the reason for this ask. And some hopefully exciting news. I don't think we'll have a specific bill by next week, but it is looking like we have a bill sponsor lined up. We're still waiting for confirmation from their staff, but we're hoping that by hopefully the beginning of April, if not the middle of April, that we will have a bill sponsor for this legislation. So we're very excited to finally have this rolling and get it started this session. I just wish it had happened a little sooner, but I'm just happy it's getting started. The next ask will be to support legislation to modify coverage for step therapy. For those, again, that don't know what step therapy is, I always like to call it fail first when I meet with legislative offices. And really what it is your insurer saying that you have to fail first on a cheaper drug before they move you to the drug that was prescribed to you. And really, this is a pretty ridiculous, policy, especially for people within the bleeding disorders community, because there are no generics. Every medication for people with bleeding disorders is expensive, and so it's ridiculous to try and have someone fail first on another medication, especially in this group or in this community. You also run the risk of inhibitors, and of course, we're trying to limit, the bad actions that can happen when a patient takes a medication. So we really want to make sure that these, protocols, as insurers like to call them, are modified so that way, if there are no generics, you don't have to go through kind of the step therapy loopholes. So we're trying to get this legislation passed. Again, similar to the copay, there is no bill number. We're still working on trying to find a bill sponsor for this. It's been a little bit harder than I would have originally hoped, but we're still working on it. And hopefully, similar to the copays, we'll have someone lined up next month or towards the end of next month. And then another one that we've been working on for a little while is a legislation to create a rare disease advisory council. This is House Bill 4169. And again, you don't need to have that memorized. All of the offices will have this information. You'll also have leave behinds that will have this information that you can give to the staffer or the legislator that you're meeting with. But the impetus behind this legislation would be to create, as it says, a rare disease advisory council, which would have a whole host of folks to help legislators, the governor, different department staff understand how a certain policy or a certain bill might impact people within the rare disease community. This is kind of an interesting bill because in the previous session, in the 2023-2024 legislative session, money was appropriated for a rare disease advisory council in a bill or in a budget that was passed. And so as of right now, there is currently a rare disease advisory council that sits under the Department of Health and Human Services. But the bill to create the Rare Disease Advisory Council never passed. So as of right now, they have funding to continue the council, but they do not have statutory authority. So the council meets, but then they don't have the authority to make recommendations to legislators, make recommendations to the governor. And so we're really trying to get this bill passed so that way everything can be formalized. And I should also mention that our very own Susan Larch does sit on the Rare Disease Advisory Council. So the bleeding disorders community does have representation on the Rare Disease Advisory Council. And we really want to make sure that, as I said, that gets formalized. Next up is asking House members to support the bipartisan package to help provide relief for medical debt. So the Senate bills are 449 through 451 and 701 and 702. I'm happy to report that those 5 bills were reported favorably out of the Senate and now sit in the House Health Policy Committee. So if you're meeting with your senator, it'll list whether or not your senator supported those bills or were a sponsor or co-sponsor. And so really what we're just asking for in those meetings is for you to say thank you. We really appreciate your support in passing this legislation and trying to make a difference for, I think it's the over 700,000 Michiganders who have some sort of medical debt. And then the House bills are 5254 and 5255. And again, those are actually also sitting in the House Health Policy Committee. So all 7 bills are currently sitting in the same committee. And so we're hoping to have those move within the next few weeks. I know some of the committee meetings that have been happening they've been focusing on a few other bills that have come before. So we're hoping that these will come up for a hearing soon. So really, as I said, the ask for these in the Senate will be to say thank you. Thank you for your support. And then in the House, we're really just asking that once it does get that hearing and kind of move into the full House and full committee, that House members support these bills and help provide the relief for medical debt that so many suffer.
And Zach, real quickly, there is a question in the chat. This is a new ask for our Lansing Days group. Is that correct?
That is correct. Yes. So this is this package as a whole was introduced last year for the first time for this session. So these are brand new bills. I've been working with one of the lead sponsors on these bills, Senator Sarah Anthony, to try and pass pass these bills. But they were first introduced last year, actually towards the end of last year. I want to say the end of October or November. So brand new bills. This is the first time we're supporting these. And you'll obviously get more information on these next Tuesday. But yes, first time. Thank you, Glenn. Next up is supporting funding for children's special healthcare services. You'll hear it be referred to as CSHCS. And really, I think this is one of the most important things that we do year after year is work to maintain the funding that is included for CSHCS. We were very fortunate last year that there was actually an increase in funding for CSHCS. But we don't want to take that for granted that legislators and the governor understand now. But as I think it was Roy said, or Keith, this is an election year. We want to make sure that for new folks that are coming in next year, they understand how important this is. For folks that are currently in office right now, we want to make sure that funding is maintained. There's a lot of battles being waged right now for funding because of cuts that were made at the federal level. And so state governments are having to kind of figure out how to make up the funding levels that were left from the federal government. And we want to make sure that in those discussions, CSHCS is held harmless. We want to make sure that the funding for CSHCS is able to be made whole. The work that CSHCS does and all the staff there really is so important, and we're so fortunate to have people with a bleeding disorder be able to access the programs at CSHCS all throughout their lifetime. So bleeding disorders are one of three groups that have a lifetime exemption for accessing the programs within CSHCS. So again, we want to make sure that funding is maintained within the budget. And we were very fortunate to see that Governor Whitmer and her proposed budget did maintain that funding and actually had a very slight increase compared to last year. And finally, this, again, similar to the medical debt, is a new issue. It came up towards the end of last month. And really, I don't know if anyone else has gotten inundated with letters in the mail and emails from both the University of Michigan Health System and Blue Cross Blue Shield of Michigan, but they are currently in an ongoing contract negotiation. And really what we're trying to ask legislators is that they encourage both parties to come to an agreement, so that way patients are not stuck between a rock and a hard place trying to figure out, how do I move my provider? How do I move my care that I've been receiving for forever at the University of Michigan? And how do I make sure that I'm still insured by Blue Cross Blue Shield? I don't want to have to change insurance. I don't want to have to change providers. We want to make sure that at the end of the day, an agreement is reached by both parties and that patients are not caught in the middle. That, I think, is the most important thing. Regardless of the outcome of how much Blue Cross is paying University of Michigan, how much the University of Michigan is paying Blue Cross, patients should not be caught in the middle of this, and we want to make sure that patients are able to continue to see their providers and maintain that insurance coverage. So that's the newest ask, and actually the final ask. But as I said, most importantly, if you're not able to get to all of these, which it would be very hard to get to all 6 in a 20-minute meeting, just remember the most important thing you can do is to share your story. They're going to remember who you are, your story, your background more than anything else. And I can always follow up at the end with kind of the asks and follow up with statistics, anything like that. But they're going to remember you more than they are ever going to remember me. So I want everyone to really hold that and go into meetings with a lot of confidence, knowing that it's your story and you're there to tell it and they're there to listen. So that's the most important thing. And I believe that's it. So if you have any questions, please feel free to come off mute. I'm going to quickly check the chat, make sure I didn't miss anything. All right. Doesn't look like I did, but please feel free to come off mute if you have any questions. of course, feel free to shoot me an email or give me a call if you have any questions that come up after the fact. More than happy to answer any. But really looking forward to seeing everyone on Tuesday night and hearing about how awesome the meetings are on Wednesday. This is my favorite event by far. I think it's better than Springfest. I know that's not great to say. Springfest is awesome, but I love Lansing Days and I love seeing everyone come back from meetings and just feel the energy of being able to share your story with the offices. But please feel free to send me any questions or any messages. And yeah, I hope everyone has a great night and thank you all for joining.
Hey Zach, can I add something real quick?
Yeah, no, please, Ken.
Hey, for anybody who doesn't already, Google your representative or your senator and get their backstory. And then just so one, you know a little bit more about them, and two, try to use something that you know about them to connect to your story.
Yeah, that's a great point. I appreciate that, Ken. And I think you better than anyone knows how impactful that can be. And I think you always do such a great job of that. I've had the good fortune of being in meetings with you and watching you advocate live and in person. And it's very, impactful to be able to immediately kind of relate to a staffer or a legislator and kind of be able to build that relationship. So I really appreciate you bringing that up. All right. I'm going to go ahead and stop recording.